Fenesin Ir is used to treat coughs and congestion caused by the common cold, bronchitis, and other breathing illnesses. It is not used for ongoing cough from smoking or long-term breathing problems unless directed by your doctor. Fenesin Ir works as an expectorant, which means it thins and loosens mucus in the airways, clears congestion, and makes breathing easier. It's important to read the package instructions carefully before using this product. This product is not recommended for children younger than 6 years, and some forms are not recommended for children younger than 12 years. Fenesin Ir does not cure or shorten the length of the common cold. To decrease the risk for side effects, carefully follow all dosage directions. It's important to not give other cough and cold medication that might contain the same or similar ingredients. Ask your doctor or pharmacist for more details about using Fenesin Ir safely. When taking Fenesin Ir, you can take it with or without food, as directed by your doctor, typically every 4 hours. If you're self-treating, make sure to follow all the directions on the product package. If you have any questions, it's best to ask your doctor or pharmacist for guidance. If you're using the liquid form of this medication, be sure to measure the dose carefully using a special measuring device or spoon. Do not use a household spoon as it may not provide the correct dose. For powder packets, empty the entire contents onto your tongue and swallow to prevent a bitter taste. The dosage of Fenesin Ir is based on your age, medical condition, and response to treatment. It's important to not take more than 6 doses in a day and to not increase your dose or take this drug more often than directed. Make sure to drink plenty of fluids while taking this medication, as it will help to break up mucus and clear congestion. If your cough is accompanied by a headache that doesn't go away, fever, severe sore throat, rash, or if it lasts, returns, or gets worse after 7 days, it's important to tell your doctor. These may be signs of a serious medical problem. If you think you may have a serious medical problem, it's crucial to seek medical help right away. If you experience nausea or vomiting while taking Fenesin Ir, it's important to let your doctor or pharmacist know. However, many people using this medication do not have any serious side effects. While it's rare, a very serious allergic reaction to Fenesin Ir can occur. Seek medical help immediately if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you experience any other effects, be sure to contact your doctor or pharmacist. As for the daily dosage and timing, it's best to follow your doctor's instructions. They have determined that the benefits of using this medication outweigh the risk of side effects. If you have any concerns or questions, don't hesitate to reach out to your healthcare provider. Before taking Fenesin Ir, make sure to inform your doctor or pharmacist about any allergies you may have and any medical conditions you are currently dealing with. It's important to discuss any breathing problems, cough with blood or large amounts of mucus, diabetes, liver disease, or phenylketonuria, PKU, with your healthcare provider before using this medication. Liquid forms of Fenesin Ir may contain sugar and/or alcohol, so if you have diabetes, liver disease, or any other condition that requires you to limit or avoid these substances, it's important to talk to your doctor or pharmacist before using this product. Additionally, the liquid forms and powder packets of this medication may contain aspartame, so if you have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame, consult your doctor or pharmacist before using this product. Before undergoing any surgical procedures, it's important to inform your doctor or dentist about all the products you are currently using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to only use Fenesin Ir if clearly needed, and to discuss the potential risks and benefits with your doctor. Additionally, it's unknown if guaifenesin, the active ingredient in Fenesin Ir, passes into breast milk, so it's important to consult your doctor before breastfeeding while using this medication. When taking Fenesin Ir, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Fenesin Ir is available in both prescription and non-prescription products, so it's essential to check the labels of all your medications to ensure you are not taking more than one product containing guaifenesin. It's also important to note that this medication may interfere with certain lab tests, potentially causing false test results. Be sure that lab personnel and all your doctors are aware that you use this drug. As for the best time to take Fenesin Ir, it's typically recommended to follow the dosage instructions provided by your doctor or on the product label. Be sure to take it as directed and consult with your healthcare provider for any specific concerns regarding daily dosage and optimal timing. If someone has taken too much Fenesin Ir and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, while in Canada, residents can call a provincial poison control center. It's crucial to act quickly in these situations to ensure the person receives the necessary medical attention. If your doctor has prescribed Fenesin Ir for you, it's important not to share it with others. Make sure to keep all your medical and lab appointments. Remember that Fenesin Ir is meant for short-term use only, so don't take it for more than 7 days unless your doctor advises otherwise. If your symptoms persist for longer than 7 days, be sure to let your doctor know. If you happen to forget a dose of Fenesin Ir, take it as soon as you remember. However, if it's almost time for your next dose, then just skip the missed one. Take the next dose at the regular time and do not take a double dose to make up for the missed one. When it comes to storing Fenesin Ir, it's best to keep it at room temperature and away from light and moisture. Make sure not to store it in the bathroom or freeze the liquid forms of this medication. Different brands may have different storage needs, so it's important to check the product package for specific instructions or ask your pharmacist for guidance. And remember to keep all medications out of reach of children and pets. When it comes to getting rid of expired or no longer needed Fenesin Ir, it's important to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do so. And as a reminder, never flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.